what I'm going to talk about today is two things I'd like you to take away from this. One is to be bold and to think differently. Not an easy task, I know, a big ask. And the second one is to humanize research. And that's what I hope I'll be able to demonstrate. What we've done with some of the wonderful women in Aberdeen that I'm working with is really humanizing research. And it was great to hear Jan mention storytelling. At the back, it was mentioned about ambassadors. So you've laid down the work, so thank you. Some really amazing talks. So what I'd like us to do is really be bold and think about how can we not just embed EDI, but actually embody it. So live it as an individual, as a team, and as an organization. So first of all, I want to just say special thanks to all of the women that are from 15 different nationalities that I'm working with. We have Gypsy Traveller Roma women, we've got women from Arab backgrounds, we've got women from Azerbaijan, you name it. I think I'm quite lucky that Aberdeen is oil and gas central area, so we've got lots of different nationalities. But this came about, we did a pilot back in 2023, and we put in some funding bids to the university, and one of the professors said, you know, this is a really hard to reach group. And I think that just made us really even more determined, no, we're definitely going to put it in for this particular group. And our aim, therefore, became very simple. Let's dispel this notion of hard to reach. And I think even till now, unfortunately, I was in an NIHR training, and it still was mentioned, that mindset of they're hard to reach, it's difficult, and I would love us to think differently. So what we'll cover today is we'll cover, and again, Jan said the who, the how, the why, the etc. So we're going to look at whose values are we embedding in our research, what's our starting point, and how do we manage to move from embedding it to actually embodying it and being authentic with that. And what could this look like in real life? So it's great to talk about it academically, theoretically, but I want to showcase what we've done with some of these women to show you a real life example. So Ed has already mentioned technocratic, so I can move on just to talk a little bit more about the democratic. There is a lot in the literature that says, and there's a lot in our values that says that we want to be democratic, but what does that actually mean in real life? How are we actually looking at that power sharing, and how we're making sure that we are making that power a little bit more equitable between our public members and between ourselves? I'm very mindful of the fact that when I look at the NIHR data, we only have 1 in 50 public member contributors are from a black background, and only 1 in 30 are from an Asian background. But thinking about that data, it's not disaggregated according to, as Professor Kunti's mentioned, Asian could be lots of different groups of Asian people. It's not disaggregated by gender. So if we look at black women, for example, we know they're highly underrepresented, and they do experience lots of health inequalities. So what we have is, we've got 3 symbols. One of them says hierarchy. So you've got the researcher at the top, and you've got your public members at the bottom. So you've got that hierarchical system for research. In the middle, we've got an icon where it talks about saviorism. So we've got a superhero standing above, and you've got your public members below. And in the far right, you have got a picture of somebody standing with a telescope and looking out onto the worldview, or epistemology, as researchers like to. I'm learning all the research words doing my PhD. Your worldview. So thinking about those 3 areas, and how can we actually disrupt that? And I think that's where the PEDRI standards come in, because they are a fantastic framework for us to actually look at each of those areas. Look at our hierarchy. Are we breaking down those hierarchies? Look at our saviorism. Are we thinking this is a problem that we need to fix? Or are we shifting our mindset and thinking, let's look at it from an asset base rather than a deficit base? And then the third one around epistemologies, it was mentioned earlier, for example, that perhaps we're looking less at the written word and more at the oral. But my kind of epistemology is that civilization historically, and for the global heritage majority women that I'm talking to, it's always been about oral histories and storytelling. So being mindful of our epistemology and our starting points might be different. Let's not limit ourselves to a Western way of looking through it. It's a shame we haven't got the pictures, but I'm sure you can imagine. So not just limiting ourselves to that Western view, but actually bringing the non-Western and the Western and the best of both. I love to bring the best of both. I'm part Persian, part English, married to an Egyptian, living in Scotland, so our kids are the United Nations. So I think that diversity is something that I very much love to celebrate. Sorry, it's jumping. So the next one is about thinking about, again, reflecting on, are we being extractive? And we don't necessarily mean to be, but sometimes we are inadvertently. This is something I'm very much struggling with myself, in that we are extracting lived experiences of people, and you can see we're then leaving people having to relive that trauma potentially. And so thinking about that continuum going from extractive, restorative, what are we actually doing to get to that end point of being restorative? What do I mean by restorative? That we're creating a healing space. As researchers, even the word research means that we're constantly taking from our public members, but actually what are we giving back? And for me, having a thesis or a publication is not giving back. We need to be restorative and create that healing space. Hence, the PEDRI standards really appealed to me, and I want us to be bold and move from embedding it to actually embodying it. So, one of the things that I would love us all to reflect on, no matter which part of the data we're looking at or what part of the research we're looking at, is to think about ethics of care. Not just your ethical approval document, which I'm dreading filling mine in because I've heard it's quite difficult, but that ethics of care and thinking about trauma and trust. A lot has been mentioned about trust today. We know that ethnic minority people, there is that hesitancy. We know that trust has been broken. If we look at colonialism, if we look at what's happened historically, we can understand why that's still prevalent today. Through those oral histories, intergenerationally, that has been passed on. It would be naive of us to think that it hasn't been. So I love to think of our public and patient involvement and engagement, PPI, as trauma and trust. And if you are not bringing that trust up, so your trust is going down, you're going to inadvertently create trauma, and vice versa. So thinking about being very balanced. So if we move on to the case study, how long have I got, Samara? Has anyone got the time? I've got 2 minutes. If we move on to the case study, again, I find that the data can be quite problematic. So if I take my husband for an example, he is Egyptian. So depending on whether there's the African Cup of Nations happening, he might be African, or if there isn't, he might be classing himself as Arab. So how we class ourselves is very much individual. I'm mixed. I mean, what does that mean? You know, how is that being looked at? So what we wanted to do is not just look at who have we got in our census data for Scotland, but also look at vulnerable groups, like, as I mentioned, Gypsy Traveller Romas, refugees, bringing in their voices into the literature, interweaving it with our literature. But we also wanted to crucially make it place-based. We're in Scotland, we wanted it to be place-based. Now, depending on the audience, when I ask this question, what do all of those heritage and ethnicities have in common? Many people may have said colonialism. I don't want to take that negative aspect, and I want it to be really positive. And this is what we came up with, weaving. So, of course, in Scotland, they have beautiful weaving, African tapestry, beautiful blankets and shawls at the traveller communities. I'm biased, of course, saying that Persian rugs are beautiful. But who does the majority of those? Historically, it's been women. And when we combine our values with our weaving as our conceptual framework and women and thinking about that empowerment, we then came up with, this is potentially a visualization of what the current state of public involvement in research looks like. So we've got the weaver as the researcher, we've got our loom as the policies and practices. Unfortunately, our threads going in are quite monotonous colour-wise in some respects, and therefore we have these gaps in representation. With the PEDRI standards, this is what we are all hopefully aiming for, this beautiful, lovely tapestry. We've got all our lovely colours, our different public and diverse publics and intersectional public coming in. They are working with us as co-researchers. Thinking about how we can actually involve them beyond focus groups, beyond interviews, and thinking about that epistemology, thinking about decolonial methods. Apologies, I'm talking very fast, I appreciate that. But sharing circles is something that we've used because then everyone's got an equitable chance and respectful chance of speaking. And so I'm just going to share with you now what this might potentially look like and how perhaps we can all use a values-based system to finish off. What we can do is we can take our PEDRI standards, we can take our project, we can take our demographics that we're looking at, and we can map it across using different authors, different journals, different people that perhaps are not in the main line that we all know about, and really searching for that diversity in terms of what we bring in when we're mapping it out. This is our values-based approach, which again aligns with the PEDRI standards. So then thinking about, okay, we take this a step further. If we've got, for example, trauma-informed, how am I going to bring that in practical terms? Or if we've got restorative, how are we going to do that? And I'm just going to finish off on the yielding one. So yielding around cultural humility and how we did that. And it was food. It was a really simple answer. It doesn't cost a lot, doesn't need a lot of resources and a lot of financing. And I had the lovely excuse of being able to have lots of delicious global food. But it really brought the women together. And so if you would like to connect, that's my LinkedIn. And I would love to be able to connect with you all. Thank you very much.